Hello and welcome to our Facebook Live on schools and school metrics. Before we begin, I want to talk about the logistics for today's event. As many of you know, the Oregon Health Authority recommends that when indoors with people who are not members of your household, you should wear a face covering. However, today we are taking off our face coverings when speaking so we can communicate with people who do not speak sign language and depend on seeing a speaker's mouth and lips. The speakers are 6 feet apart. The ASL interpreter is 11 feet from the speakers, and we have also recently upgraded the air filtration system in the building. My name is Dr. Tom Jeanne. I'm Deputy State Health Officer and Epidemiologist at the Oregon Health Authority. Before we talk about the schools, I want to acknowledge the rising trend in COVID-19 cases that we're seeing in Oregon, the United States, and around the world. Since that start of the pandemic, Oregon has had among the lowest rates of COVID-19 infection and mortality in the nation, and that remains true. But in recent weeks, we have reported record numbers of cases in our state. Last week, OHA recorded 5,177 new cases of COVID-19 infection, which is a 46% increase over the prior week's number and a new high. Today we are reporting 1,122 new cases and 4 new deaths. This is the highest number of cases reported on a single day in Oregon. This increase comes as the number of COVID-19 patients in our hospitals is also rising sharply. In response, 9 counties with high COVID case rates began a 2-week pause on social activities yesterday. Every Oregonian must take the ongoing personal protective actions to flatten the curve of COVID-19, now more than ever. Wear a face covering, stay 6 feet away from people outside your household, wash your hands frequently, and limit your social gatherings. We know this is hard. We know that everyone has made sacrifices, but we must continue this hard work to stop the spread of COVID-19. However, we also know the virus is not spreading as fast in every community, and that many counties have lower rates of positive COVID-19 tests than the state average. So 2 weeks ago, the Oregon Department of Education and the Oregon Health Authority revised Oregon's metrics for schools, which are based on case counts and rates in local communities. OHA has worked closely with ODE and the governor's office since the pandemic started to ensure our plans focus on the shared goal of ensuring the health and well-being of children and school staff. The updates to our school metrics balance 2 vital priorities. First, we want to give more students the opportunity to return to in-person instruction when it poses a lower risk to students, staff, and the community. At the same time, we want to protect students, school staff, and their families from catching COVID-19 and accelerating the spread of the virus in the broader community. These updated school reopening metrics remain among the most protective in the country, but are now more aligned with the way other states have set their measures. The metrics take into account the measures the CDC has recommended as benchmarks for school reopening, including case rates and test positivity thresholds over 14 days, risk mitigation strategies, and levels of transmission risk across different models of learning. The update also draws on our increasing awareness that kids have not been a major driver of outbreaks in Oregon or nationwide. Schools that have maintained safety protocols while providing in-person instruction have not been found to be significant sources of outbreaks or drivers of community spread. We landed on 3 major changes that will better align our metrics with neighboring states and evidence-based practices. 1, we removed the statewide 5% threshold for percentage of tests coming back positive. This change increases local focus. Oregon has many counties that are tied closely to their region or to other states, as much or more so than to the state as a whole. County test positivity remains as an important local metric. 2, we changed the review period for examining metrics data to a 2-week period rather than 3 consecutive 1-week periods. This will avoid the situations we've seen where a one-time cluster in a smaller county resets the clock for them for an additional 3 weeks. This makes the metric simpler to calculate and understand, and it aligns with CDC, California, and other states. Number 3, and lastly, we expanded the previous K-3 exception to a general metric that allows elementary schools up to grade 6 to open in a phased manner. There are several reasons for expanding K-3 to all elementary age students. At the time of the original metric, limited scientific evidence suggested that children of the K through 3 ages might be lower risk for transmitting COVID-19. However, newer evidence suggests this may not be the case, but younger children still appear to have less severe illness than older children and adults. We know that remote learning is less effective for younger students who depend on in-person time for effective learning and their cognitive and social-emotional development. Cohorting is a key strategy for preventing large outbreaks and for allowing contact tracing and quarantine. Cohorting means putting students into stable groups and minimizing mixing with other groups. And cohorting is more manageable with an elementary curriculum, so in-person instruction for these students carries lower risk than for older students, who have more individualized daily schedules that involve more mixing between cohorts. As health officials, we've heard from many families who want to see their students back in school. Recent survey data also tell us that a majority of parents are reporting significant stress in balancing work and supporting their kids in distance learning. This approach gives more schools the chance to reopen based on the conditions in their communities. If COVID-19 is under control, we know we can offer more students in-person instruction at lower risk. If COVID-19 is spreading rapidly and sporadically, these metrics tell school districts that COVID-19 is spreading too rapidly in the community and it's too soon to reopen. Finally, because the metrics take into account case counts and rates, schools and counties with very high rates will not be open for in-person education. In fact, under the current metrics, schools in the counties that are in the 2-week pause must be in comprehensive distance learning. We believe this represents a cautious approach using a simpler and clearer set of measures that are rooted in the latest scientific evidence. And now I'll turn it over to ODE Director Colt Gill.
Hi there. Thanks for joining us today. At the beginning, I'd like to take just a minute to acknowledge how challenging COVID-19 has been for our families, our students in our schools, and our educators. It has impacted our lives in unprecedented ways, and people are working really hard to overcome that. From family members falling ill to a loss of income, many students are thriving with comprehensive distance learning, and many more are struggling. Many miss interaction with their teachers and friends, and I know that teachers are also working very hard to make connections right now. And I urge you to reach out directly to your child's teacher whenever you recognize a concern with your child. I know that they will want to assist, and they may also be able to bring in additional supports as well, like school counselors and others. In Oregon today, about 60,000 of our students are participating in some form of in-person instruction at their schools, but the majority of children are participating only through distance learning. Returning to in-person instruction is an important priority for our children, families, and educators. And that's why Governor Brown, the Oregon Department of Education, and the Oregon Health Authority are focused on, first, ensuring that schools are ready to implement all the public health protocols with fidelity, and that we have worked with Oregon OSHA to improve enforcement efforts around that. These protocols are designed to keep students safe at school. They include physical distancing, face coverings, hand hygiene, cohorting, cleaning and disinfecting, airflow and ventilation, and effective screening and responses to cases quickly so that they can access the contact tracing, testing, and implementing isolation and quarantining as needed. Second, provide metrics that allow for in-person instruction at reduced levels of risk. These metrics align with CDC guidance, like Dr. Jeanne shared, and help ensure that our schools are closed to in-person instruction when case rates are too high, as they are right now in many parts of Oregon. And third, making clear how Oregonians in every county across the state can take steps needed to meet these new metrics and allow our students to return to in-person instruction by wearing face coverings, keeping our distance, washing our hands frequently, avoiding group gatherings, especially this time of year when people are gathering for the holidays, and getting a flu shot. Oregon's Ready Schools Safe Learners guidance includes strong public health protocols, and structured settings like schools greatly reduce the risk of transmission of COVID-19. Schools around the globe, in the United States and here in Oregon, that follow protocols like ours are not proving to be super spreader locations. We can prioritize student and staff health and safety during in-person instruction when community spread is sufficiently reduced and when we rely on and adhere to the health and safety protocols and tools now in place in Oregon. These metrics are based on recent studies and data. They align to the CDC guidelines. They're in line with effective standards in other states like California, and they help ODE meet its priority to return to in-person instruction. The new metrics are also a clear set of reachable targets for our communities to strive for, with a North Star of returning our students in Oregon to in-person instruction. While there are schools in Oregon that have seen positive COVID-19 tests in students or staff members, and while we will continue to identify cases in our schools, we often do this at the very beginning of the school day during screening. And when schools have all the protocols in place, we're not seeing much transmission in our schools. The guidance reduces the risk of transmission by keeping a distance between individuals, by requiring face coverings, and limiting the number of students that each person can come in contact with. Reducing cohort sizes for each person and keeping track of those interactions means that if someone at school does test positive, it's easier to determine who else might have been exposed, helping limit the spread further. No two Oregon schools are alike, and no two communities have exactly the same conditions. We can provide a statewide framework, but local decision-making is a crucial part of the Ready Schools Safe Learners guidance. We need to remember that kids are missing when they're not at school. In-person instruction provides our children and families with more than access to an equitable education. Schools are the center of many services for our students and families, offering nutritious meals, access to social, emotional, and mental health supports, as well as some of the physical health services for our students. Our first question is from Kevin. It says, what is being done to help schools manage aerosol risk? Are HVAC systems being updated? I think first it's important to know that our primary tools in reducing risk of transmission of COVID-19 are really behavioral. So they are really about keeping our face coverings on, maintaining physical distancing, in schools using tools like cohorting, having good hand hygiene, a lot of good cleaning and disinfecting. Now, having said that, having good airflow and ventilation is also important. So many of our schools have replaced their air filters with what's called MERV-type filters to help reduce the aerosol spread. We also provided to our schools in June $109 million in the CARES Act funds from the federal government that could be used for upgrades related to airflow and ventilation, HVAC system overhauls, as well as distance learning and other COVID-19 related expenses that schools are facing. So that's a resource that they have. We are working again with the federal government on additional resources related to HVAC and other efforts to help us through schools under COVID-19.
Next question comes from Rachel, who asks, or who says, schools were shut down in the spring when there were less than 100 cases a day. And she asks, why are they being reopened now when we have so many more cases? Well, that's a great question. You know, our governor in Oregon acted very early with the stay-at-home order and shutting down our schools. Traditionally, schools are a significant source of spread of infectious diseases, for example, the flu. So that was part of the decision. Since that time, we worked very hard with the ODE to come up with really carefully crafted guidelines to prevent and minimize transmission in schools. And we've also developed these metrics and updated these metrics to stratify or you know, adjust the different risk levels for each part of the state so that schools can really prioritize reopening when it's safest to do so. So it's a good question, but we're confident with these protocols in place and with the metrics that currently would have much of the state still having remote learning for schools, that we're not going to see a significant increase in spread from these metrics. The next question is from Jill. Where can we see how each county is progressing towards reopening on the metrics? Thanks for the question. So on the OHA website, we do have a list each week. It's updated each week with the metrics for each county for schools. So that's a great place to look. There's also a link that I think we can put on the screen. I think it's from the Willamette Education Service District, and that has a map showing each county with a color coding that lines up with the metrics and reopening. Next question is from Emily. New York City schools are on the verge of shutting down schools to in-person learning because their case positivity rate is about to reach 3%. Why is a positivity rate of up to 8% an acceptable measure of community spread for opening schools in Oregon? Another good question. You know, our thresholds for test positivity rates match those of CDC and many other states. New York City is obviously a pretty different from Oregon. In Oregon, we have a lot of rural communities, so it's quite different. So our test positivity again aligns with the recommended kind of national level guidelines, and currently we're actually above 8% in many counties, and that would affect their ability to open schools in person. Next question is from Kim. What is being done to increase testing for students? So one of the things we've been doing statewide is distributing some of the thousands of tests that we've received from the federal government that are rapid antigen tests. And those are being deployed to many places that need them. And one of those is schools. So for students and staff who do develop symptoms, we're working to get these rapid tests in place so they can be tested right away. Next question is from Rebecca, who asks, why can my child go to daycare to do online school, but can't go to school with the same safety measures in place? So, you know, childcare and school certainly overlap in some ways, but they're also quite different. It's not possible to do childcare remotely, you know, whereas school does have some ability to do remote learning. That's one of the big things there. It's also a question of scale. There are many more students in the K through 12 grades who are in school compared to students who would just be in childcare. So those are the main reasons for the differences there.
So our next question is from Jody. It says, if I don't feel comfortable sending my children back to school, will I have other options? And yes, you will. So under the Ready Schools Safe Learner guidance, we have asked our school districts to be prepared to offer distance learning, continue to offer distance learning to students, especially students who may be at greater risk from COVID-19 or who have household members who are at greater risk from COVID-19. Now, this will look different from school district to school district, as in Oregon, we have 197 school districts serving very diverse communities across the state. We have about 12 school districts that we consider our largest. They have over 10,000 students. And we have about a dozen school districts in Oregon that serve fewer than 10 students. So you can imagine that the resources look very different, and the teachers' abilities to meet every student's needs look different in those settings. And so in some of our smaller districts and in some of our large districts, when a family chooses to stay home, when schools are open to in-person instruction, that may mean a shift in the teacher that's serving that student, because the teacher that's currently serving the student may be moving back into the classroom with the majority of the students. So you could see some shifts like that happen, but that will still be an option.
Next question here is from Kim. Why are the metrics applied to counties and not individual school districts? That is a great question. So one of the reasons is simply practicality. If we are publishing statewide, county level metrics on the case counts, case rates, test positivity, and we work on calculating that based on all the case data that public health gets. If we went down at a really smaller level, like a school district or a town or community, that would be really burdensome to ask the schools to try to calculate those numbers, or to even ask local public health to do it at that level. The second reason is that schools are part of their communities and their broader communities. So to get it to the school district level, if a school district had a low case rate, but the neighboring school district had a high case rate, many of the people the families who have kids in the first school might actually live or work in a neighboring community. So we think counties is the best level, the best geographic area size to look at for the school metrics.
Thank you. I think I can take the next couple of questions. So one from Leslie says, what's being done to ensure high school students have the opportunity to take tests like the SAT or ACT, so tests to get ready for entry into college or university? And so the department, again in coordination and support from the Oregon Health Authority, has recently released guidance to our schools so that they understand the protocols that would need to be in place to offer tests like the SAT. We're looking to do some updates to that, again, to make sure that we can serve all the students who need to be served. And sometimes when these tests are given in our larger high schools, many students take the test at once, so we have to think about specific protocols for large groups. Next is from Kim, and she asks, will schools be open over the summer to help students that are failing? And each of our school districts in Oregon views summer school in different ways. Some have the resources to do that and some don't. This year, we are lucky that we have the Student Success Act that was passed in the legislature in 2019 that is offering some additional funding to schools. Many of them are using that funding and a special portion of that funding to open summer school programs this coming summer. So that's a possibility, but it will be district by district. And it is something that we can continue to work with the Oregon legislature around additional funding to support our summer school for students. And then I think the next one is also for me. So Allison writes in and says, why aren't teachers who are high risk allowed to work from home? And again, this is something that is district by district in Oregon. Each of our 197 school districts are independent government organizations. It is very likely that many teachers will continue to work from home in Oregon, as we have some students and families who will choose to continue with comprehensive distance learning even when in-person instruction is available. We will need teachers to support those students, so that's a possibility. And then I would encourage any teacher to work directly with their school district administration or human resources department regarding any special needs that they have if they are high risk, and to talk through what those options might look like.
Taya asks, why are colleges open when that population is at greater risk than K through 12? So colleges and universities, higher education is under a separate set of guidance. They're not under the Oregon Department of Education. It's also a very different population, different settings, many more private institutions. So there is guidance for them, and it's true that we are seeing it's pretty high case rates in the college age groups. So again, there is guidance for colleges and universities that focuses on those basic preventive measures, minimizing contact, face coverings, hand hygiene, et cetera. And I would also add that most of the spread that we've seen from college students seems to be off campus, or at least not part of the classroom setting. So there's some limited ability to control for that, since these are adults, unlike K through 12, and they may be doing things that are not actually part of the college officially. So it's a real challenge. Next question is from Vanessa. What is being done to address the rise in youth suicides in Oregon? Well, Vanessa, we haven't seen a rise in suicides in general in Oregon. We've looked at the most recent data we have, and there is no increase in 2020. We're keeping an eye on that, but there's been no increase. In terms of youth suicides, we have data from emergency department visits, urgent care visits, and poison center calls. And they are not seeing any increase in suicide-related visits or calls for youth. So we're keeping an eye on that, but it's good news so far. But I do want to acknowledge that, you know, this COVID pandemic is difficult for everybody in terms of our mental health, anxiety, depression. These are things that many, many people, including children and youth, are experiencing. I would direct you to the Safe and Strong website. We can put that on the screen for resources for how to help cope with the pandemic.
Thanks, Dr. Jeanne. I just want to add a little bit to that one. The Oregon Department of Education, through the Senate Bill 52 that was passed by the 2019 legislature, put out information to all school districts who are required to implement suicide prevention, intervention, and postvention plans. And those include during the COVID-19 and during distance learning. So your school district will have information on suicide prevention, as does the Department of Education. Which is a good lead into this next question from Maria, where it says, where can I find information from the Oregon Department of Education in Spanish, particularly information about if my child's school will be going back to in-person learning? And it's really important to remember that the decision to move to in-person learning has to fit within the state guidelines, but it is still a local decision. So even though a school district may meet the metrics, they may have other reasons, local reasons, that they choose not to move immediately back into in-person instruction. So the key source of information in any language, English or Spanish or other languages spoken here in Oregon, is always from your school district first. Most of the Oregon Department of Education's website is aimed at providing regulatory information to school districts, and then school districts use that information to communicate with the families in their own community. There are some information on the ODE website aimed directly at families and students, and we try to translate those into other languages, and those are available on our website. Then Christina asks, why aren't private schools allowed to reopen? And this is reopening to in-person instruction. And it's honestly because private schools are the same as public schools in that they carry both the same risk and the same ability to mitigate that risk to the transmission of COVID-19. So we're basing return to in-person instruction on the overall health of the community in relation to COVID-19, looking at case counts, case rates, test positivity metrics. When we believe that that is at a safe level, we're asking those schools to consider reopening to in-person instruction with a number of public health protocols in place. That applies to a private school setting in the same way it applies to a public school setting. So they're treated the same in this case.
Question from Jody. Will teachers be prioritized to receive the COVID vaccine once it's available? Well, Jody, there's a national committee that is working on prioritization for the COVID vaccine, and they have been for months. So we don't have any final prioritization list at this point, but I can tell you that the short answer is yes. Teachers are essential workers, and essential workers are among the very top groups, along with people who are at very high risk for COVID outcomes, severe outcomes, to get the vaccine. So we don't know exactly where they'll be, but they will be very near the top, is what I'm hearing.
All right, and our last question comes from Myrtle, and it says, will teachers and staff be provided with PPE? So it's important to know that for most educators and folks that work in our schools, the PPE that's required are face coverings. And outside of some cases where they're working in school-based health centers or they're working in a medical-related capacity, the face covering is the primary tool, just like it is in much of Oregon. So earlier this year, we did acquire 5 million disposable KN95 face coverings, non-medical grade, that have been distributed to our schools across the state of Oregon. So those are available right now. We have another 1.2 million cloth face coverings that we're in the process of distributing to schools around the state of Oregon right now. So we will be continuing to provide PPE to our schools. We'll work in partnership with local districts who have oftentimes also purchased their own face coverings of various types for both staff and students. Thank you.
Thank you, Director Gill, and thank you all for your questions. Take care.